Hello, I'm Dr Dhananjaya Bhat, neurosurgeon from Aster RV Hospital, Bangalore. Today, let's talk about a relatively common condition which we see, which is pediatric brain tumors. That is, brain tumors occurring in children. Tumors are nothing but abnormal proliferation of cells which result in a mass formation and present in a tissue. So, in the brain, whenever the cells, which may be neurons or it may be its supportive tissues, membranes, etc., which may grow and form a lesion. There are two types of lesions which children can develop. One is benign, which is a very slow growing tumor and which is good prognosis. And the other one is malignant, which is very rapidly growing, something like a cancerous tumor. Now, what we have to realize is that the skull is a fixed structure. It is a bone all around. And then if any extra tissue or any extra thing is put inside it, the pressure in the skull increases. And this is the one which causes all the symptoms in children. Now, depending upon the age of the child, depending on where the tumor is, whether the tumor is benign or malignant, clinical presentation varies. If it's a benign tumor, very slow growing tumor, they may have a very long history, maybe months or years. If it's a very malignant tumor, it occurs rapidly within few days, weeks, or 1 month, like that. Now, also depending on the age of the child. Now, suppose it's an infant. In an infant, the infant cannot talk, cannot express. So they will present generally as irritability, crying, not eating, drowsiness, and in their head, the skull bones are not fused. So it starts expanding. So the head size becomes up. And then they have some eye movement abnormalities. The eye starts looking down only. Some prominent blood vessels can be seen on the scalp. So these features indicate that there is some problem in the child. There may be some intracranial pathology in these infants. Now, as the age of the child increases, for example, in a smaller child, 2 years, 3 years children, they may have difficulty in walking. There may be imbalance while walking. Their eyes may turn in different directions. They may have headache, vomiting. And one more very interesting feature which many of these children have is that they may develop a visual loss. For example, one eye may become completely blind, but the child will not be able to express, child will not know. So suddenly, one fine day when suddenly the child rubs the normal eye, then it realizes that the other eye it cannot see anything. So many children we do see who come with one eye complete visual loss. And then even in elder people like 10 years, 15 years children, they may express with headache, vomiting, difficulty in swallowing, visual blurring, etc. Now, the causes of these brain tumors, as I told, may be benign or malignant. And the most common one in these patients are known as gliomas. Gliomas are very common in this age group. And the most common in this is pilocytic astrocytoma, which is a very benign tumor. And complete surgical excision will result in good outcomes. And the most malignant one is known as grade 4 glioblastoma, which are very bad prognosis. And luckily, these are rare in children. Depending on certain specific sites where this tumor occurs, characteristic clinical findings may be present. One structure known as the pituitary gland is present. So tumors around in that area, known as most commonly like craniopharyngiomas. These children present with a very unique clinical manifestations like short growth, stunted growth, endocrine dysfunctions, excessive urination, and visual loss. Certain children, when tumors are present in the ventricles, there is something known as the ventricles where CSF is present. So when tumors are present over there, again these children may present with headache, vomiting, as well as blurring of vision and ataxia, imbalance while walking. Now next, once all these symptoms are there and you come to our clinic for examination, we do a thorough clinical examination. We do a top to down, head to toe neurological examination, including vision, smell, speech, limb movements, coordination. All those things are assessed. And then we get a fairly good idea that there is something wrong in the child and this may be the pathology. And then next is the child is subjected to investigations, which is most commonly a CT or an MRI. MRI is relatively probably more safer and more accurate. It delineates the pathology better. It is safer in terms that it's not a radiation. So it's just magnetic waves which go. So it is quite very safe for children. So that is what we do. But the downside of MRI is that children have to cooperate. They have to lie down still for 20 minutes. In a CT scan, it's hardly a minute. But this is for 20 minutes. They have to lie inside one cylinder sort of thing, which they may become claustrophobic. So for such children, we may have to give sedation or anesthesia and then do the MRI. MRI, both plain and contrast MRI is done where we give an injection and the tumor lights up. So it helps us in identifying the tumor completely very well. Once MRI is done, these are the two basic investigations which do, but depending upon the condition of the child, we involve multidisciplinary team like the ophthalmologist for the vision, endocrinologist to see whether the hormones are all right, and all those things we have to do. And once MRI is done and we diagnose it as a tumor, next comes is our planning for surgery. Now surgery, the outcomes of surgery depend not only on whether the tumor is benign or malignant, but it also depends where the tumor is located. If it is located in a very non-eloquent, that is not a very important area in the brain, or whether if it is located on the surface of the brain, it is quite easy to operate and we can remove the tumor almost completely and good results will be present. But unfortunately, some of the tumors are located in very deep and very eloquent structures, very critical structures, something known as the brain stem and thalamus. Those areas are highly critical. You just touch that area and then you'll end up in problem, either weakness or altered sensorium and sometimes even death. So if it is superficially present, the tumor, and can be operable, then we go in all out for the surgery, and the detailed surgery planning is done. We have an intraoperative MRI also, which helps us during intraoperative surgery. Then for marking the flap, where to operate, which part of the brain to touch, we use something known as neuronavigation, which tells us exactly where the tumor is and which part of the skull we have to open. And during surgery also we use a lot of monitorings known as neurophysiological monitorings, like electrodes are placed over the brain and small current is given, and then we know which area of the brain is getting stimulated. And if some area the hand moves, then we know, oh, this is the hand area, we have to be careful. This is the leg area, we have to be careful. If certain areas where there is no stimulation, then we know, okay, it might be a dispensable area, which might not be exactly, and then we can safely remove the tumor. During surgery, we get an MRI to confirm that whether complete tumor removal is done. And then once everything is fine, patient will be shifted to ICU, and most of them do well. And coming to surgical approaches, not all tumors are operated from the skull. Certain tumors can be operated endoscopically via the nose, or even through the brain also a small hole can be made and we can operate endoscopically. So all these are, each patient is different and we have to individualize the treatment. Following surgery, once the histopathology report comes, if it is a benign tumor, then generally we don't have to do anything. We have to just keep on follow-up, regular scans have to be done. But if unfortunately it comes as malignant, then we have to subject the child for further adjuvant therapy like radiation therapy, chemotherapy will be needed to be given. And all these children have to be on close follow-up, so that in case any early recurrence occurs, we can rapidly treat it. On the whole, in a nutshell to tell, brain tumors in children are quite common, but most of them are benign and most of them can be treated very effectively. Some unfortunate few have bad tumors, which maximum safe care can also be given at Aster RV Hospital. Thank you.